Hi there, I'm Catherine at Arcadia Physiotherapy, and I want to tell you today about how to activate your glute muscles. Lots of people have lower back pain, and that can be for a variety of reasons, but sometimes it's because your glutes, your bottom, is not activating as it should. The whole of your back and your lower legs all are connected in a chain. So you've got your hamstrings, your glutes, your lower back muscles, and even up to your shoulder in sort of diagonal slings. If one of those muscles isn't working, then the other muscles often get overloaded and do too much work. And that's quite commonly the glutes for people who sit all day, or for whatever reason have maybe been injured on one side, or it's just not switching on as well as it should or as soon as it should. So I often see this with people with lower back pain. So what I'm just going to show you is the first level, the basic activation of glutes, to raise your awareness of what your bottom feels like, how it connects to your brain and everything, and that's the starting point for then moving on to do more dynamic things such as squats and so on. So it's very simple, just lying on your tummy, coming down into a nice relaxed position, and then what you can do is just think about squeezing your bottom first of all, and even that in itself can sometimes be a bit vague for people, and it's hard to connect, so you can always just have a feel and see if you can feel the muscles contracting as you squeeze. Okay? Now lots of people, when they raise their leg up in the air, they arch their back, and they can often use the sort of opposite shoulder to lift up, and that creates a focal point in the middle of the lower back, and that's where the pain can often be, and you can feel the muscles often quite tight depending on which side is affected. So what I'd like you to do is, in this nice relaxed position, squeeze your bottom and then lift your leg. And you should feel that that puts a lot less strain on your lower back, and I'm not arching it in any way. So this is quite a simple exercise. You can add load by raising slightly higher, and even not touching the floor when you go down, just keeping that contraction on as you go through. If you find that your back starts to hurt, or you feel like you're sort of arching and compensating or trying to use other parts of your body to lift that leg, just rest and relax. Maybe just come up into a nice child's pose just to stretch things out a bit, and then start again. Usually I'll say if you start for about 1 to 2 minutes, depending on how far down the line you are already. And I go with what you tolerate, and actually if you've got a good side, then also you can work on that side and compare how the two get on, and how frequently or how much time you can do for each leg. And ideally, obviously, we want to be strong on both sides and match them both up. So this is Catherine from Arcadia Physiotherapy. I hope that's been useful to you, and if you want to contact me at any point to ask any questions or book an appointment, my website's www.arcadia-therapy.com. Hope to see you soon. Bye.